Hello, my name is Sarah Calloway, and I'm one of the musculoskeletal clinical specialists here in physiotherapy for Berkshire Healthcare Foundation Trust. And we are going to go through a webinar today on hand and wrist injuries. Just get my presentation ready for you. So, this is a webinar for anybody who has injured their hand, wrist, fingers, thumbs, or had a fracture to any of those areas. It is not for people who have had any surgery to the hand or wrist, because with this, you will have specific advice from your consultant and probably specific protocols to follow. So please, if this is the case, do seek medical advice from your surgical team. So we have lots of soft tissues, including ligaments, muscles, tendons, cartilage, nerves, and these can become injured in a number of ways. Hand and finger trauma is one of the most common things that presents to A&E. And distal radial fractures, so one of the most common wrist fractures, is the most common type of fracture in terms of upper limbs that presents to A&E. So with either of these types of injuries, we need to think about healing times. Healing takes 3 months and beyond. So if we're thinking about our normal stages of healing, we need to allow for the tissues to repair, and we need to listen to the affected joints, muscles, tendons. So if you have a soft tissue injury, you want to gradually think about getting back to some normal movement. And if you have a fracture, you want to think about making sure we're waiting for the fracture to unite together, which happens about 6 weeks before you put any pressure or weight or using your hand or wrist normally. So you can move the joints around the fracture site from early on, as long as that fracture site and area is being protected. So the other joints around can be moved to stop them stiffening up. With a fracture, the strength behind the fracture site and the consolidation that happens occurs at about 12 weeks. So it's not until this point in time that you are allowed to do really heavy lifting or any contact sports. The other thing to remember is that smoking really affects healing and slows down the healing times, whatever the type of injury that you have. So it is really worth seeking smoking cessation advice to help you cut down and ideally stop. And this will allow the tissues to heal much more quickly. Sleep also affects healing, and our body recovers at night when we're sleeping. So again, it's really important to have good sleep hygiene to allow any injury to repair itself in the best possible way. So early movement of any joints is really important because it helps to stop the joints stiffening up. It helps to mobilize the areas around the injury and to help pump any swelling and fluid away, to allow for more joint space, to allow for more movement. So we want to try and think about exercising and moving the injured area if it's a soft tissue injury and the areas around a fracture site from early on. And we want to do this about 4 to 5 times a day. We want to listen to the pain and use that as a guide. So with a soft tissue injury, you should be able to gradually over time start to move the affected area, and as the days and weeks go on, you should feel like you get more and more movement. With a fracture, again, we want to think about moving the areas around, and depending on what the fracture management is from your fracture clinic, whether you've been strapped or put in a splint or taped, you'll have been told in terms of the fracture management how long to stay in that splint or that strapping for. And If you're immobilized at the fracture site with, for example, a splint, you would obviously try to move the areas around the fracture site early on so they don't stiffen up. And then in terms of guidance from your consultant, you can then start to move the fractured area. And the physiotherapist can guide you with this. But we can start getting the fractured area moving from normally about 3 or 4 weeks, depending what the injury is. And then, as I say, you want to make sure you're not putting normal weight and using the hand or wrist for normal daily activities until about 6 weeks, and really heavy activities or sports at 12 weeks. So in terms of the hand, what often happens if there's an injury anywhere else to the hand or wrist is that because of the complicated anatomy and the multiple joints and tendons in this area, it's really common for the hand to get really stiff and stuck if we let it keep still for any length of time. So what you want to try and aim for is to get your hand to be able to do a hook and a fist. So, for example, if you had a fracture to this finger, you might need to immobilize this finger for the first 3 or 4 weeks, maybe up to 6 weeks. But the other fingers we can try and get moving around that. The same if we have a wrist fracture, what we often find is this area is either splinted or in a plaster cast, but the patient's hand and fingers and thumb can get really, really stiff. So even though we may be immobilized in a splint or cast, we can still go through different movements of the fingers or thumb. So what I want to do is go through tendon gliding exercises with you now. So the best thing to do is to try and pop your elbows onto a table and to also do the exercise both hands together, because it helps with the feedback and crossover in the brain, so your brain knows what normal is and helps you reproduce that on the affected side. And it helps you to see what you're aiming for compared to your good or better hand or finger. So with tendon gliding exercises, we want to think about bending from the large knuckles into a duck shape. Then we go down into a flat fist, curl the fingers up into a full fist, roll up into a hook, stretch the fingers up, and then go in and out with the fingers as well. So this is something that you can practice regularly with the fingers to make sure the joints go through that range of movement. With your thumbs, you want to think about stretching them up and away, but also coming into a nice O shape for opposition. So we want to think about opposing the thumb from the index finger to the index finger, then the middle finger, the ring finger, the little finger, rolling and stretching the thumb down the little finger and then coming back out. So to keep that thumb moving, a nice O shape across to each fingertip and then run down, stretch away. So this will help all the joints of the thumb move. In terms of our wrists, we want to think about coming through some movement into flexion, extension, and radial and ulnar deviation, side to side. And also making sure that we can tuck our elbows in and we can have our palms up to the ceiling and down. So this movement is really important for hygiene purposes, to be able to reach around behind your back for toileting. We need to have good supination for day-to-day life. The other thing to think about is if you have an injury to any of the hand or wrist, we obviously tend to naturally protect that that area, which is understandable. To begin with, we need to make sure we protect. But the rest of the arm can get quite stiff, because if we think about the normal amount of movement our arm and hand goes through in day-to-day life, if we're not reaching and using our hand as normal, the rest of the elbow and then mainly the shoulder can get quite stiff. So it's really important to make sure that you stretch your shoulder as well rotate it out to the side and try and get your hand up behind your back just to stop the shoulder stiffening up, and also to bend and straighten the elbow as well. The other thing to think about with any injury or fracture to the hand and wrist is thinking about managing the swelling. So you can use an ice pack to help reduce this, and ice will also help with pain and stop any further trauma to the tissues. So it's best to make sure that you wrap an ice pack, something that you're maybe a packet of peas out the freezer or something you're not going to eat. Have that as your ice pack so you can reuse it. And make sure you wrap it in a damp tea towel or damp towel, and that's going to protect the skin, because you can cause an ice burn if you don't protect the skin properly. The other thing to think about is making sure there isn't any nerve damage to the area from your injury or from a previous injury. So can you tell the difference between hot and cold? And therefore that will allow you to be able to tell if the ice pack is too cold and causing an ice burn. So make sure you can tell the difference between hot and cold first, then think about applying the ice wrapped in a damp tea towel for up to 20 minutes. And you can do this maybe 3 or 4 times a day, just don't do it more than every hour. The other thing that's really good to do is elevate the hand or wrist higher than your heart. So this helps to drain the fluid back into the lymphatic system. And it's important to combine sometimes the ice and the elevation so that we help drain that fluid away. The other thing that tends to happen is as we're walking along, we're swinging our arms by our side, and therefore gravity will track the fluid down. So sometimes if you're walking, it's quite nice to pop your hand across into your coat or jacket or into your pocket so that the hand isn't hanging down, and that will then increase the swelling. And then, as we've talked about, we want to do our movement. This helps the muscles of the hand and wrist pump that fluid away back into the rest of the body. So all of those things can help with the swelling. The more we get the swelling down, the better you'll be able to move. So some precautions. So as with any injury, you want to make sure that you listen to the pain, listen to how it's feeling, and you know your body the best. So you obviously, understandably, with some injuries or fractures, you might feel some pain to begin with. This should start to gradually get better over time. And if it doesn't, you need to seek some medical attention. Also think about speaking to your GP or pharmacist to make sure your pain is well controlled. The other thing is to just keep an eye on your hand or wrist injury and observe the hand, checking for redness, heat or swelling or any signs of infection, making sure that the swelling is starting to gradually go down over time. And the other thing is it's really important to make sure, as we've talked about with these movement exercises, that all of the joints can move properly. There are some finger injuries where the tendons can be damaged and you can't actively move the joint. If this is the case, you must seek immediate medical attention because it might mean that a tendon needs repairing urgently. So as long as you can move the joints a little bit, that's really important. And as I say, this should get steadily better over time. So as we said in the beginning, we want to think about healing times, doing light activities only to begin with, and then gradually building up what we do. So building up over time the amount of pressure and activity you're putting through your hand or wrist. And we're thinking about that fracture healing again, as we talked about, 6 weeks for heavier or more normal duties through the hand and wrist, and 12 weeks for anything heavy. So if you feel like the injury that you have is not getting better and you need some help, physiotherapy can help with managing the pain, the swelling, and getting the hand moving, building up your strength, power, and grip. So if you feel that you need some extra support, you can ask your GP or your consultant to refer you into physiotherapy. The other thing to think about is balance exercises. Often injuries to this area come from a fall, and we want to make sure that we reduce that risk of falling. Doing balance exercises is really important for anyone of any age, and It is a help for the brain as well as the body. So it's important to do balance exercises to help your balance reactions to try to prevent any falling happening again in the future. So if you're doing this, thinking about maybe things like standing with your feet together or one in front of the other or on one leg to challenge your balance, but always making sure that you're making the environment really safe. So have a chair behind you and something to hold on to just in case you do start to fall. And you can start by doing these balance exercises, holding on, and then you can always gradually reduce the support a little bit as you feel you get better. If you are worried about falling, there are falls services that we have in the community, and we have community-based exercise classes. So your GP or healthcare professional can refer you to these services if that is something you're also worried about. And thank you very much for listening. Hope you find the information useful, and yeah, good luck.